Well, I think the service as a whole, it's kind of opened up a new way of doing things, really. So any patient that's now being discharged from hospital, kind of depending on what condition they have, if it's kind of from like a rehab side of things, it's a system that obviously can be transferred and it can be used in lots of different ways now. Rather than keeping patients in hospital because you're not quite sure whether they're ready to be discharged or not, and it's kind of you're a bit uncertain. You can get them home and you know someone's keeping an eye on them for a couple of weeks. So I think it can be used in multiple ways, really.
The patients actually, like I said, feel quite supported, being called twice a week. You can identify patients that are about to have an exacerbation or flare up. I've also picked up quite a few patients that, because we're monitoring them, we can build up a trend and see what's happening. For example, I think quite a few patients on my caseload that weren't on blood pressure medication, just from monitoring them, I realized and picked up that they actually had high blood pressure. And again, that was not known to the patient because they were asymptomatic, not known to the GP. So things like that were picked up and communicated to the GP, and the patient then got started on blood pressure medication.
I don't think it's better or worse. I think it depends on the patient. I think it depends on, by doing this, it means now we can open it out to a lot more patients. So for instance, people that still work, who can't attend classes twice a week, people who just don't want to join a group and exercise. So I think it depends on the patient, but by doing this, it has meant that we can cover more patients, and they can do more what they're comfortable with as well.
I think it's been a huge challenge for us and for the patients, because it's very different when you're used to seeing your heart failure nurse face to face, then having to use digital health. I think what we've learned is that it doesn't suit everybody, but for the individuals that it does work with, it's an extremely effective way of providing care to the patient in the home and keeping them safe. Certainly, once I got confidence with using digital health, I was able to titrate medications at home. So it was a very effective way of keeping the patient safe and still doing my job as a heart failure nurse.
We will still be doing classes because there's a lot of patients that still like to do classes because of the social aspect, and just that they get more out of that. They feel more comfortable, they're more motivated to come to a class. So I think what we'll be doing is both, and purely depending on what the patient wants to do.
The feedback that we've had from our patients has been extremely positive. All the patients really that have been partaking in the service, we've had a very small dropout rate, which really highlights the success of the service itself.
So we've had over 200 patients now kind of coming onto the virtual ward, which is amazing, really. And I think having this service has really declined the amount of readmissions there would have been. I think we've only had 9 actually readmitted into hospital, and I know from speaking to a lot of patients, times when they would have maybe called 999 or 111 because they were worried, and the fact they know they've got someone actually watching what they input, they felt confident that they didn't need to make that call because they know someone's keeping an eye on them, and that our team will call them if they need to.
I think many patients initially utilising the digital platform is a new concept, and I think during the pandemic itself, it's been a new concept for staff members as well as patients. And I think once we had the adequate training and really built our confidence, it's now really become embedded within our service as a normal method of delivery, and has proven to be safe as well as quite effective as well for many of our patients.
The telehealth also has a video consultation, which is very important and very useful. Once we get to communicate with the patient in that way, we can see the patient, we can identify things, we can teach them inhaler technique, breathing techniques, and also see if they are in any respiratory distress. So I think having a digital platform has been huge benefits, for keeping patients at home. In the autumn, we moved into of 2020, we moved into supporting COVID patients. These are COVID patients who are deemed to be okay to go home, but actually needed that support. And we supported them for about 14 days, again using the telehealth format, the digital format. This was greatly received by the patients. They felt reassured, they felt supported.
Now that we have this amazing opportunity that we've been successfully managing throughout the pandemic period, I think in terms of in the future, I can only see that this particular level of service will continue to grow and develop with the feedback that we're receiving from our patients and the involvement that they will also have in supporting the service to continue developing it further.